You did something this morning that I need to talk to you about. You probably don't remember doing it. It took about 15 seconds. You've done it every single day of your adult life. And if you're over 60 and on any kind of heart or blood pressure medication, it is one of the most dangerous things you do all day. I'm not being dramatic, I'm being a cardiologist who has seen what happens when this goes wrong. His name was Harold, 71 years old, healthy, active, well-managed medications. The kind of patient I look forward to seeing, because his numbers were good and his attitude was better. On a Tuesday morning, his wife Elaine called me at 6:47 a.m. Her voice was shaking. "Ben, he's on the bathroom floor." Harold hadn't had a heart attack. He hadn't had a stroke. He had simply gotten out of bed the same way he had for 50 years. And his body at 71 on those medications after that night's sleep couldn't handle it anymore. And that habit almost killed him. I've been a cardiologist for over 20 years, and I've sat across from thousands of patients in that time. What I'm going to share with you today is one of the most consistently overlooked cardiovascular risks in adults over 60. Not because the research doesn't exist, because it absolutely does, but because it almost never comes up in a standard 15-minute appointment. It happens in the first 30 seconds of your morning. You've probably done it today, and by the end of this video you will never do it the same way again. I'm also going to give you a specific 7-step morning protocol that takes less than 3 minutes and is backed by real cardiology research. But I need to build to it because without understanding why it matters for your age group specifically, the steps won't fully make sense. Stay with me. This is worth your full attention. Before we go further, drop your age in the comments right now and tell me, do you ever feel dizzy, lighted, or just a little unsteady when you first stand up in the morning, even occasionally? Even something you've written off as just part of getting older? I want to know. You'd be surprised how many people are going to read your comment and say, "That's me too." Now let me take you back to Harold. Harold was not what most people picture when they imagine someone at cardiac risk. Sharp, engaged, proud of his retirement. Every morning, he and his wife Elaine had coffee together at the kitchen table before his walk. He was on 2 medications, Linopril for blood pressure, a low-dose statin. Both managed well for 7 years. At his last appointment, I had told him he was doing great. But Harold had a habit. Every morning, alarm at 6:15, sit up fast, legs over the side, stand up, walk to the bathroom, 15 seconds, start to finish. He'd done it that way his entire adult life. And for most of his life, his body had handled it fine. Here's what changed. As Harold moved through his late 60s into his 70s, his autonomic nervous system, the system that automatically regulates blood pressure, began to slow. Not dramatically, not in any way that showed on a test. Quietly, gradually, the way so many age-related changes happen. At the same time, his blood pressure medication was doing its job overnight, which meant by 6 a.m. his blood pressure was at its daily low. And because Harold, like most people his age, avoided fluids after dinner to prevent nighttime bathroom trips, he was waking up mildly dehydrated, which thickens the blood slightly and reduces the volume circulating through his system. 3 factors: slower autonomic response, medication at its lowest level, mild dehydration, and then Harold stands up fast. His blood pressure, already lower than ideal, drops further. His body tries to compensate, tries to constrict blood vessels and speed up his heart to push blood back to the brain. But the compensation is too slow. Blood flow to the brain dips, and Harold grabs the bathroom sink. The first time it happened, he didn't tell me. He told Elaine it was nothing. He told himself it was nothing. He was fine within seconds and went on with his walk. The second time, 3 weeks later, he wasn't fine within seconds. He lost consciousness. Doctors call this syncope, a sudden temporary loss of consciousness from reduced blood flow to the brain. And when he came to, he was on the floor with Elaine already on the phone. In the ER, his EKG was normal. His blood work was largely unremarkable. The attending physician was thorough, but with normal test results in front of him, Harold was discharged that afternoon with instructions to follow up with his cardiologist. This is where Harold got lucky, and I use that word deliberately, because luck shouldn't be the deciding factor in a situation this preventable. Harold's daughter Christine was a nurse practitioner. She visited that weekend and started asking very specific questions about his morning routine. What time did he take his medications? Did he drink anything before standing? How quickly did he go from lying to standing? The more Harold answered, the more focused Christine's expression became. She called me Sunday evening. We talked for 20 minutes. I made two immediate changes, adjusted the timing of his blood pressure medication, and walked him through the morning protocol I'm going to give you before this video ends. But first I need to explain what is actually happening inside your body during those first 30 seconds of your morning, because once you understand the physiology, you won't need to be reminded to take this seriously. The first thing you need to understand is orthostatic hypotension. Orthostatic simply means related to standing upright. Hypotension means low blood pressure. Combined, it describes a well-documented phenomenon where blood pressure drops significantly within 3 minutes of standing, causing dizziness, lightedness, blurred vision, and in serious cases fainting and falls. A study published in the journal Hypertension in 2019 found that orthostatic hypotension affects approximately 1 in 5 adults over the age of 65. 1 in 5. This is not a rare condition. It is a remarkably common one that simply doesn't get enough attention in standard appointments. And here is what makes it more dangerous than most people realize. It's not always dramatic. Many people with orthostatic hypotension don't faint. They just feel briefly off when they stand. A moment of lightheadedness that passes in seconds and gets filed away as just part of getting older. But research from the American Heart Association has shown that repeated episodes, even mild ones, are associated with significantly increased risk of falls, cardiovascular events, and cognitive decline over time. This is not something to dismiss. The second reason the morning is specifically dangerous is the circadian pattern of cardiovascular events. Your cardiovascular system follows a rhythm tied to your sleep-wake cycle. The window between roughly 6 a.m. and 10 a.m. consistently shows the highest rates of heart attack, sudden cardiac death, and stroke. Research published in the journal Circulation has documented this morning surge in cardiovascular events. Clearly, the reasons include a natural rise in blood pressure, increased platelet aggregation, blood is more prone to clotting, and elevated catecholamines, the stress hormones like adrenaline that flood your system as it shifts from sleep to wakefulness. Your body is doing significant physiological work in those first hours of the morning, and that work creates real vulnerability. Now add the third factor, and this is the one that most patients have genuinely never thought about. Many common heart and blood pressure medications have what pharmacologists call a trough period, the window when the medication is at its lowest concentration in your bloodstream, providing the least protection. For most people who take their medications in the evening or at bedtime, that trough period lands in the early morning hours. The window when your medication is least effective is the exact window when your cardiovascular system is most biologically vulnerable. A 2022 review in the European Heart Journal examining chronopharmacology, the study of how medication timing interacts with your body's natural rhythms, found meaningful evidence that timing of blood pressure medications can significantly affect both efficacy and risk, particularly in older adults. This is worth a conversation with your pharmacist or physician. The fourth factor is something almost every senior I've worked with is doing without realizing it carries a cost. Waking up dehydrated. Older adults have a well-documented reduction in thirst sensitivity. The hypothalamic mechanism that tells you to drink water becomes less responsive with age. Many people over 65 also deliberately limit evening fluids to avoid nighttime bathroom trips, which is understandable, but creates a physiological price. By 6 a.m., after 8 hours without fluids, plus what your body used overnight, blood volume is lower and blood is slightly thicker. Your cardiovascular system has less fluid to work with precisely when it needs to maintain pressure during a position change. The fifth factor ties everything together, the aging autonomic nervous system. When you stand up, your sympathetic nervous system is supposed to immediately constrict peripheral blood vessels and nudge your heart rate upward to maintain pressure against gravity. In a younger adult, this takes 1 to 2 seconds. Seamless, unnoticeable. Research published in the journal Clinical Autonomic Research has demonstrated clearly that this response time slows with age. The reflex is still there, but the extra 2, 3, 4 seconds it now takes to fully engage, that is the window. That is where the dizziness lives. That is where falls happen. And in someone with underlying cardiovascular vulnerability, that is where more serious events can be triggered. Harold had all 5 of these factors working against him at once. And Harold is not an outlier. He is one of the most common presentations I see in cardiology. Now I want to share a few more stories because this risk doesn't look the same in everyone, and I want you to see yourself or someone you love in at least one of these. Comment below and tell me which of these resonates most with you. I'll explain why that matters in a moment. Margaret was 67, a retired registered nurse who had spent 2 decades working in a cardiac care unit. If anyone should have connected the dots on herself, it was Margaret. She knew what orthostatic hypotension was. She'd helped patients manage it throughout her career. But she told me when she first came to my practice that she had genuinely never applied that knowledge to herself. I thought of it as something that happened to sick patients. She said I walked 4 miles a day. She had been experiencing morning lightheadedness for 8 months before her daughter convinced her to mention it at an appointment. The fix was straightforward: a medication timing adjustment and a commitment to drinking water before standing. Within 6 weeks, symptoms were gone. I took care of everyone else for 30 years, she told me at her follow-up, and didn't catch this in myself. Margaret, that is not something to be embarrassed about. This is genuinely the kind of thing that gets missed. Then there's Gerald, 78 years old, former contractor, built with the kind of constitution that made him deeply resistant to the idea that his body wasn't working exactly as it always had. He had dismissed morning dizziness for nearly a year. Just getting old, he told himself. The person who caught it wasn't his cardiologist or his PCP. It was his pharmacist. During a routine medication review, Gerald had gone in for a refill, and his pharmacist asked a few questions and flagged the relationship between his medication timing and his morning symptoms. Gerald called his doctor that afternoon. That call led to a referral, which led to a diagnosis of clinically significant orthostatic hypotension that had been present and completely undetected for months. Gerald is now 80. He takes his mornings slower, keeps water on his nightstand, and says his words. I listen to my pharmacist a lot more than I used to. Diane was 64, still working part-time, rushed mornings, alarm at 6:30, out the door by 6:45. She took her blood pressure medication with a sip of coffee, not water, coffee, and didn't sit down properly for 4 hours. One Tuesday in October, she blacked out in a parking garage. A stranger found her on the ground. Her ER workup was like Harold's, largely unremarkable on standard tests. What changed her outcome wasn't a new medication. It wasn't a procedure. It was a recalibration of how she started her day. Once her cardiologist asked the right questions about her morning routine, and then there are Robert and Carol, both 72, both on similar blood pressure medications. Robert's cardiologist had walked him through the morning protocol at his last visit. Carol's physician, thorough and excellent, simply hadn't had time to cover it. The result: Robert had the information. Carol didn't. Carol fell in their hallway one morning and fractured her wrist. She recovered fully, but Robert told me afterward, we were doing everything the same, and I had the information and she didn't. That felt wrong to me. He brought Carol to her next appointment with a specific list of questions. That is exactly what this video is designed to help you do. Now, let me give you what you came here for. The 30-second morning mistake is this: standing up immediately after waking, moving from horizontal to vertical, before your cardiovascular system has had any time to transition from its sleep state physiology to its upright active physiology. That is the core of it. But it's almost never just that single action. It's that action compounded by everything we've discussed. Medication at its trough, overnight dehydration, slowed autonomic response, and the inherent cardiovascular vulnerability of the early morning hours. Here's what happens inside your body when this goes wrong. You wake up. You're horizontal. Blood distributed relatively evenly. Your heart working comfortably without fighting gravity. You stand up quickly. Approximately 300 to 800 milliliters of blood, roughly 1 to 3 cups, shifts downward into your legs under gravity. Your sympathetic nervous system is supposed to respond instantly. But in someone over 65, with the compounding factors we've covered, it lags for 2, 3, maybe 4 critical seconds. Cardiac output drops, cerebral blood flow decreases, and that is the window, that is where dizziness lives. That is where falls happen. And in someone with cardiovascular vulnerability, that is where more serious events begin. This is called the morning cardiovascular vulnerability window. It is real, it is well documented, and it is preventable. Here is your 7-step morning protocol. Write this down or save this video because this is the part I want you to actually use. Step 1. Before you sit up, before the covers even come back, Spend 20 to 30 seconds doing ankle circles and flexing your feet up and down. The calf muscles act as a secondary pump for your lower body, squeezing blood back toward your core. Activating them before you stand directly reduces the gravitational blood shift that causes orthostatic hypotension. This costs you 30 seconds and nothing else. Step 2. Keep a glass of water on your nightstand every night and drink it before you stand, 8 ounces minimum. This directly addresses morning dehydration, increases circulating blood volume, and gives your cardiovascular system what it needs to maintain pressure during position changes. This single habit change has made a measurable difference for many of my patients. Step 3. Sit on the edge of the bed for a full 60 seconds before standing, not 5 seconds. 60. Use a timer if you need one. Sitting upright is an intermediate cardiovascular position. Your body adjusts to partial gravitational load, giving your autonomic nervous system time to engage before you go fully vertical. This stage transition is one of the most consistently effective interventions for orthostatic hypotension used in geriatric cardiology. Step 4. When you do stand, do it next to something you can hold, a nightstand, a bedpost, a wall for the first several seconds. Not because you expect to fall, because you are giving your body a safety net during those first seconds of autonomic adjustment. This is intelligent cardiovascular management, not weakness. Step 5. Ask your pharmacist this specific question at your next refill. Given the medications I'm taking, is there a timing that would be safer for my morning cardiovascular risk? Your pharmacist has your complete medication list, understands trough and peak periods, and is a genuinely underutilized resource for this kind of optimization. This question is free and could be one of the most valuable conversations you have this year. Step 6. Begin monitoring your blood pressure each morning in a seated position before taking your medications. Log it and bring this specific question to your next doctor's appointment. Write it down. Can you check my blood pressure both lying down and standing at my next visit? This is called orthostatic blood pressure testing. It takes about 2 minutes to perform and directly tells your doctor whether you have significant orthostatic hypotension. Many patients have never had it done. You now know to ask for it by name. Step 7. Share this protocol with every person in your household taking heart or blood pressure medication. Share it with your adult children. Share it with a friend who mentions morning dizziness. Because as Robert and Carol showed us, whether you have this information shouldn't depend on whether your specific doctor happened to cover it in your last appointment. Now let me address the questions I know are forming. You might be wondering, I've gotten up fast my entire life. Why does this matter more now? Because this is an age-related change in autonomic function, compounded by the higher likelihood of being on cardiovascular medications and greater baseline dehydration risk. At 40, your system compensated so quickly the vulnerability window was essentially zero. By 65-705, that window has widened in ways that are clinically meaningful. The same action carries a different risk profile at a different stage of life. You might be wondering, my doctor never mentioned this. Should I be concerned they missed something? The honest answer is nuanced. Your doctor is not negligent for not covering this in a standard appointment. There is genuinely more relevant information about senior cardiovascular health than fits into the available time in most medical practices. Bring it up proactively at your next visit using the specific questions I've given you. You are not challenging your doctor by doing this. You are helping them help you more effectively. What if I take my medications at night? Does this still apply? Yes, and in some ways more so. If you take blood pressure medications at bedtime, your trough period may fall in the early morning hours, aligning directly with the cardiovascular vulnerability window. The morning protocol matters regardless of medication timing because dehydration, autonomic lag, and the morning surge period are present either way. How do I know if I have orthostatic hypotension? The diagnostic standard is the orthostatic blood pressure test I mentioned. Lying pressure, then standing pressure measured at 1 and 3 minutes. Symptoms alone aren't always reliable, because the condition can be present without dramatic symptoms, particularly in older adults who have adapted to mild hypotension over time. Ask for this test by name, and if the person at risk lives alone, send them this video, not a summary, the actual video, because a fall or cardiac event with no one nearby to help is a different category of danger entirely. And the protocol I've described takes less than 3 minutes in the morning and costs nothing. Let me bring you back to Harold. Harold is 73 now. Elaine calls him her reformed morning person. He keeps water on his nightstand. He does his ankle circles before the covers come back. He sits on the edge of the bed for 60 seconds and looks out at his backyard. He says he started noticing things in those 60 seconds he'd missed for years. His morning blood pressure is logged in a small notebook he brings to every appointment. He hasn't had a single episode of dizziness or syncope in 18 months. But here's what I saved for the end. At his senior center, Harold runs a Thursday morning coffee group. About 6 months after his own episode, he asked if he could share the morning protocol with the group. He printed it on a single sheet of paper and handed it to 23 people. 4 of them brought it to their own doctors and were diagnosed with clinically significant orthostatic hypotension that had never been identified. One of them had been experiencing morning dizziness for 3 years. 3 years the information existed, the testing existed, the conversation simply hadn't happened yet. That is what this channel exists to do. Not to replace your doctor, not to frighten you, to make sure that the conversations that can directly change your safety and your health, your morning, your life, actually happen. You deserve to walk into your next appointment knowing this. Before you close this video, I want you to do one thing. Comment below with one of 3 responses. Commenting protocol if you're going to implement these steps. Comment doctor conversation if you're bringing up the orthostatic blood pressure test at your next appointment. Comment sharing this if there's someone specific, a spouse, a parent, a friend you're going to send this to today. I read these comments, my team reads these comments, they matter. And if you know someone over 65 who takes blood pressure or heart medication and starts their morning the way Harold used to, please share this video with them today, not next week, today. Because the morning they need this information might be tomorrow morning. If you haven't subscribed, please do. Every video on this channel is built on the same standard, real research, real patient experience, and information worth bringing to your medical team. Save this video. Come back to it before your next cardiology appointment. The 7 steps are here. The questions to ask your doctor are here. The conversation starter for your pharmacist is here. You watched all the way through. That tells me something about you. Use what you learned today, and thank you for being here.